Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about another success story. This is number 2 on the day, and I can't wait to share this one with you. So first, let's tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. And you can do one of two things. You can either schedule a consultation directly with me, or you can fill out a questionnaire and get some feedback about your vision. Now, let's talk about our success story that we have number 2 on the day. So this particular patient is over the age of 60, and we're super excited that she came into the office today for a follow-up in between her phase 1 and phase 2 of her program. Phase 1 for us is a initial 3 to 4 month time frame where we're using Syntonics only to help stimulate the brain of our patient to get whatever kind of desired result at the end that we want to see. And then in phase 2, they get connected with a therapist. So they get assigned to a therapist. They come into the active part of therapy where it's a bit more hands-on, and they're continuing to work on Syntonics during that phase. So she was coming in for a checkup before moving into phase 2. And I'm very excited to say that her esotropia, which is an eye turn in, was lessened today, and we were able to reduce her prism power for her glasses. Now, we're technically not going to reduce the power for her prisms just yet because she had a prism power of 8, and today she measured at a 6 being acceptable for her. But I usually don't like to prescribe multiple pairs of glasses to where a person has to constantly get new lenses made all the time. So we will technically hold on and wait until she drops even more, to the point where we can probably just take her completely out of the prism. But this is one of those cases where she kept digging and looking and searching for an answer and believing she didn't have to just keep taking more prism power in her glasses in order to align her eyes and see a single image. She believed that it was going to cause her problems over time and that she would be kind of stuck with the prism in the glasses if she kept going that route. So she really wanted to seek out a type of treatment where we were reducing the lens power of the prism naturally by training her brain how to use her 2 eyes together. And that's exactly what we've got going on. So here we are just 3 months into phase 1 and now getting ready to move on to phase 2 of our treatment program, and we've already reduced the prism from an 8 to a 6. Once again, I don't typically change those powers too quickly because I want to see that it's significant enough. In her case, because it's an 8 to start with, and that's what she's got in her current glasses, she's now measuring a 6. We'll probably wait until she's down to the point where she's about at a 2, and then just tell her to take her prism totally out, and we'll give her a new lens prescription without the prism in there. So she's actively knowing how to pull and align her eyes, and today she was showing me if I really concentrate, if I pay attention, I can pull my eyes out and align them and not allow the eye to cross in. And she could do that at will. So even in phase 1, after just a short amount of time, with not really even the hands-on component, just the electrical stimulation of the brain, of teaching the brain how to align and use the eyes better, I'm going to show you a filter. Here is the green filter that you can see. It's awesome. Okay, that's the filter that we use in order to train patients who are esotropia to kind of like it electrically triggers the muscles of the eyes to relax and not cross in. So just in phase 1, she's had these changes. Now, if you're, maybe you have esotropia, maybe you have exotropia, maybe you have hypertropia, and you have a lens prescription that has a prism in order to maintain the alignment of your eyes so that you don't see double. But you're kind of, searching and looking for an answer to get out of that prism. Well, we may be your answer. So give us a call at 618-288-1489 if you're local. If you're not local, go to our website at visionforlifeworks.com, and you can do one of two things. You can either fill out the questionnaire, or you can click on the schedule a consultation and schedule a time to consult with me directly. And if you haven't done so, please like this video. Make sure that you're subscribed to our YouTube channel, and that way you can follow all of our videos, as well as also make sure that if you know someone who could benefit, maybe it's not you, but maybe you know someone who has prism in their glasses and they'd like to get out of them, please pass this video on. Thank you.